Hey, this is BJ Murphy, publisher of Neuse. We're here at UNC Health Lenoir to meet our new hospital CEO, Dr. Crystal Hayden. And while here, we're going to check out a breakthrough therapy called Hyperbaric Oxygen Therapy. Our hospital's been here for 117 years, and last year alone, they had over 37,000 emergency room visits and almost 4,000 surgeries. So come with me as we meet Dr. Hayden and visit this brand new breakthrough therapy. So Dr. Hayden, we're in your office now. Tell me about Crystal Hayden. Where's she from? Where'd she grow up? Where'd you go to school?
So I have been in Eastern North Carolina since 1995. I came here as a military spouse, married to my best friend of 36 years, and it's been quite an adventure. We have remained in Eastern North Carolina since 1995 and really feel like this part of the state is our home. We've been in Onslow County, we've been in Nash County, we're in Lenoir County, and really just have a heart for the rural community setting. I went to school in Hawaii when we were stationed over there.
I'm a little jealous of that, actually.
And that's probably a whole nother interview, but there's a lot to be jealous of, but then there is a lot of challenge with going to school and being so far from home and family and support. But it's really where we kind of grew up together.
So when you think about operations and the financial health of this hospital, how's the financial health today, and where do you see that in the future?
Sure. So what I want everybody to know is that we are not going anywhere, right? Certainly the financial performance of the last several years has not been where we want it to be, and we are embarking on a financial stability and turnaround plan that will take 3 years to get us to a cash flow positive.
Well, that's interesting, because I remember your previous two CEOs, I believe, Mr. Enders and Gary Black. I knew Mr. Black well, and I remember that one thing that he was attributed with, and the board at the time, was the operations is difficult to get in the black, and it was a lot of the investments that really kept the hospital afloat. And so from an operational standpoint, I can see how that's very difficult, because you're going to treat people if they walk in the door, right?
That's right. That's right. So there's two things that are always true. One, every year our payers are going to try to pay us less, and every year we're going to need to pay our staff more. And so it's our responsibility as leaders to manage our resources and really look at 3 different ways of achieving financial stability. And in no particular order: strategic growth, increased volume, and managing expenses. And so how do we maximize the volume and the revenue from that volume, and while also managing expenses? You can't cut your way into profitability. That's not ever a good strategy, and it's not sustainable. You'll damage the organization if you try to do that. So we need to grow, we need to maximize our revenue opportunities, and then be responsible in how we manage our finances.
So I would imagine we're going to see this hyperbaric oxygen chamber therapy here in a moment. I would imagine that as a new therapy is one of those opportunities you see as increasing the services to the community, fulfilling the need, of course, but also giving the hospital a chance to have some financial success as well. So as we think about the Hyperbaric Oxygen Treatment Center that we're about to go see, in the Wound and Infusion Center, that is an opportunity for you to fulfill a need in the community, as well provide a service, and as well as to help the hospital on the financial end, right?
That's right. So that's how we all come together, right? It's what do our patients need, what can we provide, and then how does it benefit not only the care and treatment of the patients, but also the overall performance of the hospital. I do understand that my predecessors relied heavily on investments and on savings, and that's a great strategy, but at the end of the day, if you constantly take out of your savings account to make ends meet, pretty soon you don't have a savings account. We're not anywhere close to that. but my responsibility, as I see it, is to make sure that we don't get close to that.
And I get that. Most people don't think about the hospital in terms of a business. They think about, if I need surgery or if I have an accident, I go there. And so they're only thinking about the healthcare side, not the fact that you have to pay for the lights to be on, for the water and the sewer in the building, to the staffing, and as well as the supplies. And so this interesting, this dialogue about the profitability of a hospital, because technically you're a nonprofit, but you've got to make some in order to reinvest back into the hospital.
That's right. So that's a really good point on two different levels. One is, I want to make sure, we don't receive funding from any source other than what we generate through business. So there's no federal or state grant that helps us operate. There's no infusion of money from some charitable force out there that helps us keep running. What we earn is based purely on what we do. And then we do have all of the expenses of any business, staffing expenses, utilities. We have to get to a point where we can reinvest in the infrastructure, because you don't want to come to a hospital to receive care that isn't kept up to date and isn't a safe environment. And so we don't make money to make a profit. We make money to pay our staff fairly and to keep the infrastructure of the hospital safe and a healing environment.
I'm Kiva Sandlin, nurse practitioner, and I am one of the providers here with the UNC Lenoir Wound Center.
So tell me about this. It looks like a submarine right here. I don't know, which floor are we on? The first floor? No, we're on the fifth floor now. So tell us about what this chamber is.
So this is a hyperbaric oxygen therapy chamber, and for simplicity of it, we sort of submerge people to a depth of about 2 atmospheric pressures or so. Don't go under the water, but it's as if you are. And we fill the chamber with 100% oxygen, and that oxygen is compressed in that diving down, as we call it, into that atmospheric level. And you get a lot of oxygen in your bloodstream. Wounds heal quite
So if I had
rapidly.
surgery recently or a diabetic wound?
If you have a diabetic wound that is qualifiable, covered by your insurance, then you would benefit. You would get new growth of vasculature because of that oxygenation. Wounds heal quite more rapidly because of the oxygenation. And I mean, it's not just diabetic wounds. There are other treatments that we're providing here with radiation injuries. People who have had injuries, poor healing of irradiated areas, radiation cystitis, proctitis, radiation wounds that have occurred in the neck and various areas.
So you open up this door here and then you slide a bed in there, or do I just crawl? How does that work?
Well, our HBO techs are the trained professionals who do that. I don't do that part. I look in their ears, make sure that they're safe to dive.
Oh, I didn't think about that, because when I'm on an airplane, I'm the guy that has airplanes. I have to take Sudafed. I have to clear it all out because the pressure gets to me.
So we pre-screen people for their ability to dive, because just like you said, they have to be able to clear their ears, because you can rupture those eardrums by doing this treatment.
So you pre-screen, you slide in here, and then you hit a bunch of buttons here, and
I do
turns
not
it
do
all
the buttons. But yeah, they set the dial for where they want to go. Actually, it's this dial. We usually are diving between the 2 and 2.5 area, and then over about 10 or 15 minutes, the pressure increases, and it's as if they're going underwater. And when you see the 2 eras match, then they're there for about 90 minutes, and then they stay there, get their oxygen treatment, and then it's time to come back up to sea level.
I think we should do like a test, Dr. Hayden. Can you jump in there? Let's just
I
see.
would trust this team, and I would do that in a heartbeat, but I don't think you want me to do that today.
And the hope is 10 to 15 minutes once they've gone through this therapy. Is this something you only do one time? You do it multiple times? How does that
No,
work?
it's usually around 30, 40 dives that you
Okay.
would do consecutively. We don't dive on the weekend, but Monday through Friday we're putting people.
I think
in
it's really cool you call it diving because you
We-
said it
it's right.
feels
It's
like
as
that.
if they're going down to the depth of 2 to 2.5 atmospheric pressures under sea level.
One thing that I find interesting is when we first looked at what these hyperbaric oxygen chambers would look like, some were actually, they look like they're closed, but this one is
Yeah.
clear so you can
We
see.
like that.
Mhm.
Yeah, I think our patients like it. It doesn't feel as, closed in. Claustrophobia
Right.
is one of the concerning issues with patients.
Another
but,
reason I probably wouldn't qualify.
Yeah. Well, people have, people do really well, even if they think they may have confinement issues. We can put them in and close the door and see how you feel without going to that depth.
And so how long have we been using these chambers now?
We started July 31st. Was
Okay.
our first.
So about how many patients have you already seen? Do you know?
We are up to 5 patients a day right
Really?
now, and we're about to start our 6th patient very
Wow.
soon, and that's max. That's
So-
our max capacity.
And that you got 2 chambers.
We didn't,
Right.
yeah, we didn't anticipate being that busy,
Right.
but we are that busy, and thankfully so.
And this was made possible. The hospital has a foundation.
Yes, sir.
So from golf tournaments to all the other ways they raise money, but that's a big part of how you're able to afford to buy these machines, right?
That's right. The foundation provided a grant
Mhm.
that enabled us to purchase the 2 units. And so we are very appreciative of their support and their commitment to patient care.
Right. So for the business community, for the philanthropists in the community, like this is what that money goes towards.
That's right.
Mhm.
That's right. This is a very tangible element of what those donations can do.
All right. It's pretty amazing. Is there anything else we need to know, or you want the community to know about what these chambers are capable of doing, or the benefits?
Well, some say it treats wrinkles, but we don't offer that. So no, I'm just kidding. No.
Age-defying chambers.
Yeah, yes. I wish that were the case.
If y'all
Then
could-
I might get in.
Right. Wouldn't we all?
But, there are certain diagnoses that can be treated. Not any and everything can go in the chamber. We do screen for safety to make sure you are safe to go in the chamber. But, we would like to, encourage our providers that if they think they have somebody who might need this type treatment, to reach out to us, send them over. We'll look at it, we'll evaluate them, and
So
see
is
how that
it
goes.
your general physician? Is that the person who's referring to the hospital
yeah.
to this unit?
Yeah.
Okay. What is the tie with, say, for example, Lenoir Community College as it comes to the hospital?
Sure. So Lenoir Community College has really high quality healthcare programs across a variety of disciplines. And so we're really excited to partner with them, whether it's through clinical experiences or scholarship opportunities. It's in a rural setting. It's the community colleges that are really going to help you staff your hospital.
Right.
And so we also have a relationship where some of their leadership is on the hospital board. And so there is a constant interaction and exchange there. But supporting each organization, supporting the other, especially as it pertains to workforce development and getting our community college students gainfully and actively employed at graduation, and giving them the opportunity to give back to their community.
It seems like the nursing, I've always heard about this nursing shortage, and that it's a real thing. And the future of healthcare is that there may even be a larger need for nurses.
The shortages come and go. I think what is so challenging about the shortage that we're in right now is that it was really exacerbated by COVID. We had people who were close but not at retirement who just decided they were done. And then we had, at the same time, we had people who really needed to just step away from the profession during the pandemic.
I can imagine the strain, thinking you're near retirement, but also the mental strain and you're honestly overworked during that time.
That's right. And even for that part of our workforce that had children at home, right? And it's a little bit scary when you're in a pandemic situation, you know, what are you carrying home?
Right.
Kind of thing. Even though we know now with hindsight that, you know, that impact may not have been as significant as we thought it was. But then we also had healthcare programs, whether it be nursing or radiology technicians or pharmacy providers or what have you, that the programs couldn't enroll as many people, or the programs had to close down for a little while during COVID. And so this particular shortage has been exacerbated by the impacts of the pandemic, and we need to get back to normal operating procedures, not only from operational in the hospital, but then, you know, normal activities and normal interactions with the community colleges and with the schools and clinical experiences and bringing students in and bringing new professionals in.
Right.
And having the programs open up capacity and volume to bring in more students into their programs.
Is this hospital prepared for another potential outbreak or whatever the next thing may be?
Absolutely. Absolutely. We have a very strong infection prevention program, and that's important because it's across all types of infection, whether it's respiratory or airborne or droplet. It doesn't matter what that mode of transmission is. Our infection prevention program at this hospital is top-notch and is ready to respond to that. We also were able to, during COVID, use some of the extra funds to convert some of our patient care areas into very safe, very high-quality areas where we can care for those patients and really make sure that both the patients and the staff are safe. And so those stand ready to serve again should they be needed. And then, of course, we learned a lot during the pandemic.
Including like supply chain. I mean, just getting some supplies was a challenge.
And all of those lessons we learned will make us better positioned to respond in the future if we need to.
So, I mean, just the idea that you grew up in Eastern North Carolina, or spent a lot of your adult time here in Eastern North Carolina, and your professional career, and now your family's here. I mean, you understand the unique challenges that rural Eastern North Carolina faces. I know that a few years ago, I think it's 6-7 years ago, the hospital joined forces with the UNC system. Tell us about the benefits of that as a whole for healthcare in our community.
Sure. So I think that healthcare today is really challenging for independent rural community hospitals. Reimbursement is tough. Supply expenses are high. Staffing expenses are high. And it's just really hard to go it alone and to be by yourself. The agreement, the management agreement with UNC is just that. It's an agreement that they will help manage our operations. They do not own us. They did not purchase us. We are still an independent entity, and we have an independent board of directors. It's really the best of both worlds. We get to take advantage of payer contracts, of supply chain contracts, and that type of thing. And we also get to choose if there are things we don't want to participate in. And then probably a really good example of a benefit that we would not have otherwise been able to partake of is the use of Epic, and that's the electronic medical record. And Epic is a top-notch, very user-friendly, very intelligent EMR, but it is also an EMR that rural community hospitals cannot afford on their own. And so it was through the partnership with UNC and their agreement with Epic that allowed us to be able to implement that EMR.
as a CEO of this hospital, I mean, I was born here. It was LMH as long as I can remember. You know, what do you think about the future of this hospital, and what are some of the things you want to work on? I know you've been here 90 days, but I'm sure you've thought about this from a long-term perspective. What are some of the things, as y'all think about your strategic plan, that you want to see happen over the next 5, 10, or 20 years?
Yep. So I think first and foremost, we need to commit to our identity. And we can't be all things to all people, but we can do core services very, very well. And so identifying what those core services are and investing intentionally and unashamedly into those services and really growing them. And at the same time, we are on a quality improvement journey that has us at a really strong performance level. It's been almost a year since we've had a catheter-associated infection, and that's really something to be proud of. So while we're addressing quality and we're identifying who we are and what we're going to intentionally invest in and intentionally grow, it's going to help with the financial stability of the organization. I think what's really important is that the community understand this is a really great hospital. The staff here is committed and dedicated and passionate. We deliver really high quality care, and we can be the place that you choose to come. Right. And I think working on that community perception and that community relationship is going to be imperative to completing the turnaround of the hospital.
As I think about it, most people's experience with the hospital is actually a negative in terms of they're injured, or they have to come here late at night because an urgent care or the Kansas Community Health Center is not open. I'd love to touch on a little bit about your relationship with the health center, but I also want to touch a little bit about on I guess people's relationship with the emergency room and how they view the hospital.
So the emergency department is the front door to any hospital, and we recognize that. And we are working very diligently to ensure that it is a high quality, efficient experience. I think the frustrating thing for most folks is that when they come to the emergency department, it's not because they want to. It's because they don't feel good, they've been injured, they're sick, and it's not always easy to understand why you might have to wait, or why somebody else who arrived after you might get seen before you. And the important thing about the emergency department is you don't get seen based on your order of arrival, like at a restaurant. You get seen due to what your clinical condition is. And so if you and I both walked in and I had a sore throat and an earache, and you were having chest pain, you would be seen before I would, but I'm not going to know what your complaint is. And so it can be frustrating for me. And so we're constantly looking at ways that we can continue to provide high quality care, but do it efficiently and to do it as quickly as possible so that we can get our patients through the emergency department and either admitted or discharged home in a timely manner so that they can get into a more comfortable environment, because we recognize that they're not feeling well, and that's why they're visiting us.
Talk about a little bit about the benefit of having something like the Kansas Community Health Center in our community, and how that helps the hospital and benefit the community as a whole.
The Community Health Center is really a great resource, and one that we should not take for granted. It serves our population in a very affordable way, and it allows patients who may not otherwise have access to health care to get that access. And we have a commitment and a desire to partner with them and to work closely with them so that we can provide our patients with a continuum of care, and that after the hospitalization there's a place to go for follow-up, and there is a provider that can help them manage a pregnancy or a chronic disease. And so it's really about the right care in the right place at the right time. And sometimes that's going to be a health center, sometimes it's going to be a primary physician office, sometimes it's going to be an emergency department. But we need to make sure as healthcare providers in the community, that we're really focused on helping our patients be in the right place at the right time. UNC Health Lenoir is a really great resource and asset for this community, and I think for folks who live in Eastern North Carolina, we have seen communities lose that asset and that resource. Some have been recently, and others have been, in the last 5 or 10 years, but it is not something we should take for granted. And so my responsibility and the leadership team's responsibility here is to ensure that this hospital remains a community resource well into the future. And also understanding that we are a partner to the community. We want to interact with the community and support our patients before they're patients.
Right.
And whether it's cooking lessons at a farmer's market, or it's reading to school children, or it's some other type of partnership with a community collaborative, we want to be outside of the 4 walls of the hospital. So when you do have to come visit us at 2 o'clock in the morning in the emergency department, it doesn't feel quite so strange and quite so scary.
Right. No, that's very good. Well, thank you, Dr. Hayden. I
Yeah.
appreciate it very much.
Absolutely.
Appreciate you being here and joining us.